we're rolling. Good morning. I'd like to call this CUPHD Board of Health monthly meeting to order. It's Monday, July 11th, 2022. It's actually not Monday, July 11th. It's, so it's the 14th, so it'll be Thursday, the 14th, 2022 at 8:30 a.m.
8.
Sorry. So it's 8 a.m. Jeez.
Yes.
So full disclosure, I'm leaving for vacation right after this meeting.
Oh,
So
yay.
I've got one foot out the door, as you can tell by the way I'm reading this.
Okay.
Look, everybody's here.
Sorry.
It's like an alternative meeting or something. Roll call, please.
Roll call today, Andrew Ornstrom.
Yes.
Kyle Patterson.
Here.
Danielle Chenoweth.
All right, we have a quorum. I'd entertain a motion to approve the agenda as written.
So moved.
Second, any discussion? All those in favor, sign of aye. Aye.
Aye.
Opposed? That carries. Approval of the meeting minutes from June 16th, 2022.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed? That carries. Public participation. Anybody like to address this body? Seeing none. Correspondence?
No, nothing.
Nothing good.
Nothing, well, you know, we have monkeypox case,
Yeah.
but that's not
It's
correspondence.
good news.
But yeah, it's good news. Yeah, no.
Okay. We have no old business, new business. Treasurer's report. Ron.
Yeah, the treasurer's report as of the end of May 2022 showing cash on hand at just under 5.5 million, giving our total fund balance just under 7.5 million, which represents 42% of the budgeted expenditures for the year. At the end of our 11th fiscal month, we had a surplus of $1,076,882. The income statement portion, we had total revenues of $13.3 million. That was $2.2 million under the year-to-date annual budget, mainly due to contracts and grants, which were $2.2 million under the year-to-date budget. Expenditures through 11 months was $12.2 million, which is $3.9 million under year-to-date budgets, mainly due to the personnel and benefits, which make up for about $2.1 million of the total under budget portion.
Thank you. Any questions for the treasurer? All right. Actually, we'll place that on file. Entertain a motion to place that report on file.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Aye. Opposed? That carries. Mandy, do you have anything you'd like to add? Okay. Approval of payments to Board of Health appointees. Treasurer Ron Fields for services rendered in June 2022 for $734.40. Check request 4208.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed? That carries. Accounts payable invoices to be approved. Quarterly reimbursement to the City of Champaign for environmental health city license fees for $5,070. Check request 4217.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed? That carries. Quarterly reimbursement for City of Urbana for environmental health city license fees for $15,607. Check request 4218.
So moved.
Second, just so Champaign's twice the size, but they have 3 times the fees. Is that just because their fee structure is so different?
You wanna?
No, it's, the city of Urbana has a higher city fee. And so it's just, city of Champaign doesn't charge as much.
Gotcha.
Theirs is like 20 and city of Urbana is like 80.
Quite a bit more. Okay. Is Urbana any sense?
Yeah, I know, right?
We have a motion and a second. Any other questions or discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. Questica Inc. for power plant annual maintenance and hosting from July 1, 2022 through June 30th, 2023 for $5,000. Check request 4004.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed? That carries. Ratification of sub-award from Carl Addiction Recovery for funding for providing prompt deliverables per agreement during the period of July 1, 2021 through June 30, 2022 for $20,000. Are those dates accurate?
Yes.
Okay. Check request 4125.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Aye, opposed, that carries. Ratification of sub-award from Rosecrans Treatment Funding for providing prompt deliverables per agreement during the period of July 1, 2021 through June 30th, 2022 for $20,000. Check request 4121, sorry guys.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed, that carries. Ratification of sub-award from the Salvation Army of Champaign County for providing grant deliverables during COVID-19 during the period of July 1, 2021 through June 30th, 2022 for $10,000. Check request 4128.
So moved.
Second, discussion. All those in favor?
Aye.
Opposed, that carries. Return of unused FY 2022 Prevention Initiative grant funds to the Illinois State Board of Education in the amount of $9,795. Check request 3944.
So moved.
Second, just out of curiosity, how come we weren't able to spend them down, do we know?
Which was this one? This was Brandon's?
Is it a great start? Yeah.
Not enough clients, I would imagine.
Okay.
Turnover.
Any other discussion? All those in favor, sign of aye.
Aye.
Opposed, that carries. Champaign County GIS Consortium for Annual Principal Data Client Agreement 59 from July 1, 2022 through June 30th, 2023 for $5,788. Check request 4969.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed, that carries. Review of monthly credit card statement. Anybody have any questions or concerns? Hearing none. Approval of American Environmental Cooperation for development of a community-wide COVID-19 after-action review and improvement plan for $23,824.
So moved.
Second, can you just
Well,
summarize?
Yeah, this is, it's actually not really, I don't think that has that been fully approved yet by you? It's gonna be pending approval for you. This is the place that's out of Indiana. We thought it was out in Illinois, that's why we couldn't find it. But what it is a company, you wanna explain it? It's a company we know the people working for it.
Yeah.
Used to work for IDPH. but-
Yeah, they help other counties develop a hazard mitigation plan. So we decided on working with them as an outside impartial entity to bring all of our community partners together to develop an AAR. We wanted a historical document as well as a document that could guide us to make improvements for the future.
No, I think it's awesome. I was assuming that's how I understood it. So is that the total cost of $23,824? Is it possible community partners may share any of that cost or no?
Well, it would be lovely, but I wouldn't hold my breath
I
on it.
wouldn't
We
either,
can
but-
try, but the good thing about this, I think, is just exactly what he said. It's not us doing it because we were obviously a big part of it,
Right.
so we need somebody else out there.
Non-partial.
Taking the
Yeah.
whole, everybody that was involved, because this will happen again,
Yeah.
something like this, and we need to know what we can do to improve it, so.
No, I think it's a great idea.
Yeah, I mean, we can always ask them for some funds to help with that, but I wouldn't hold my breath.
Well, and I think, yeah, I mean, the AAR will benefit us as much, if not more than anybody else.
Yeah,
so-
and if it was a huge fire, I don't think the fire department would ask us.
Probably not.
So
Yeah.
that's kind of how I look at it. Luckily, fires happen more frequently than major pandemics,
Yes,
so.
thank goodness. Any other questions or discussions? All those in favor, sign of aye.
Aye.
Opposed, that carries. Approval of lease agreement between CUPHD and Avencia Community Health Center, an Illinois not-for-profit corporation for Suite 4E at CUPHD, 201 West Kenyon Road, Champaign, Illinois, from August 1st, 2022 through July 31st, 2023 for $750 a month.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed, that carries. Comment on board policy regarding purchasing limits. Are you asking for our comment on that, or?
I think this was from Mandy, and I wasn't clear on whether I should include it or not, or we can actually, if you prefer, we can push this to the,
Yeah, I study
Study
session.
session.
I think this was supposed to be a study session, but she asked me if she should put it on here. I said, well, put it on so we can at least,
Yeah, acknowledge that we need a study session for it.
yeah.
I
So
think that's
this
good.
is just to talk about, moving forward, what kind of things do you want approved and what do you not, and whether
Well, we
if
give
can
the
change
board
the
chair
purchase.
the
Correct.
autonomy to do previous to a board
Yeah.
meeting for the purposes of speediness. Okay. Yeah, so if we could schedule a study session, maybe early fall. Pending grant contracts for the administrator to sign, there's one, an agreement between CUPHD and the Public Health Institute of Metropolitan Chicago for affirming care training, in which CUPHD will receive $15,000 for going through this training.
So moved.
Second, what's the training?
It's actually increasing routine HIV testing in STI clinics, and so they're coming in to do training with all of our staff to make our services more accessible to all of our community residents.
Awesome. Thanks, Katie. Any other questions or discussions? Hearing none, all those in favor, sign of aye.
Aye.
Opposed? That carries. The next meeting's a study session on Wednesday, July 27th, 2022 at 10:30 a.m. if needed, followed by a monthly board meeting Monday, August 8th, 2022 at 4:30. We are now adjourned.